So I'm Holly. In 2023, here I go already. I was diagnosed with stage 3C ovarian cancer with peritoneal carcinomatosis. For those of you that don't understand, there are 4 stages in cancer. So the 4th one being the worst. The first one is being detected the earliest in the very beginning stages. So 3C is one step away from being the worst, meaning that it had metastasized and invaded the neighboring areas in my body. Stage 4 would have been that it had invaded the lymph and spread throughout. So I was one step away from that. The peritoneal carcinomatosis means that it had spread throughout my abdomen. It's kind of like a layering on all the tissue inside my belly. I was diagnosed officially, I knew officially on April 1st that year, kind of in a roundabout way. I had started having vague complaints and issues. Nothing really screamed out to me. I just knew that something was wrong. Feeling some sensations of being bloated, having urgency really to go to use the bathroom to urinate. Again, those things oftentimes go with uterine fibroids. That's kind of the path that we had started down with my gynecologist. She had sent me for some tests for that. None of those really showed anything that was out of the ordinary. But what did show is I had a colonoscopy ordered, and my gynecologist had said, well, let's get this done first. And if colonoscopy is okay, then we'll proceed and treat you as if you have uterine fibroids, and we'll decide what our course of action will be from there. So I had my colonoscopy done, and through the patient portals now you get lots of information before you hear anything from your doctors. And it was April 1st, which was a Saturday, and I had a notification on my email that there was new results. So I signed on to my patient portal, and the results of a biopsy they had taken in the colonoscopy, it said that I had, it was a cancer inside the colon with Mullerian cells, which I had to Google, but it meant that it was a cancer that had spread from ovarian primary source. So at that point in time, that's all I knew, was that I had cancer and that it had already spread into my colon. I am fortunate enough to be a nurse. Fortunate and unfortunate because I know people in the medical community, but I also have knowledge which most others don't. And I understand a lot more than a lot of other people don't. And I kind of scared myself because of the people and the experiences that I have met in my career. Started me down a very dark road. Most of the people that I've worked with in my career were end-of-life cancer patients, and that's all I knew. I didn't know a lot of survivors personally. You know, most of them were the people that I was helping them in their end of life. So I went down a very dark road. And then as soon as I was able to contact my gynecologist and told her what the colonoscopy report said, she had me set up for testing immediately. I had blood drawn that same day. The following morning, I had a CAT scan, and that is when that resulted, when I found out how extensive it was. They could see almost every little bit of it there. She immediately referred me to a bigger center where they had gynecology oncologists, and I had met with that physician within a couple of weeks probably of my initial April 1st knowing that I had cancer. I have to say that the physician that I have, my gynecology oncologist, is absolutely fantastic. And I'm so happy and pleased that she was spearheading my team. She decided that the best course of action for me was going to be surgery first, and then they would do probably 6 rounds of chemo. And that was the initial plan. My surgery date was set for April 20th, which happens to be the day before my husband's birthday. So he had the joy of spending his birthday at the hospital with me. So the day came, and in I went for surgery, expecting that the surgery would be all done and complete when I came out. When I woke up, I remember asking a couple initial questions and hearing that they really weren't able to do anything because there was too much cancer. Again, in my line of work, I knew exactly what that meant. It meant not good things. And bad enough where they had to rethink their line of attack on how we were going to treat this. So at least with that surgery, they were able to get good biopsies, and they were able to find out exactly what kind of cancer that I have. For me, it turned out to be a low-grade serous ovarian cancer. Good and bad. Good in the fact that it's a slow-growing cancer. Most cancers are quick, fast-growing, but this one is slow, which is a good thing. But the bad thing is that chemo usually does not work for it, because chemo is designed to attack fast and rapid growing cells. So it really didn't target this one at all. So they changed the plans. She decided that we would start chemo treatment, do 3 rounds. She would gather her team, and then my surgery would be later in the summer of 2023. So that's how we started. That first couple of days after my initial surgery in April, they started with my first round of chemo right there while I was still recovering after surgery. And then I had 2 more rounds following that. Okay, so I had my first round of chemo while I was still in the hospital a day or 2 after my initial surgery. That surgery was supposed to be the surgery, but ended up really an opportunity for them to get some good biopsies. So we regrouped, made a new plan of attack. My gynecology oncologist gathered a team of surgeons and support staff around her and scheduled my surgery for June 29th of 2023. That was to start first case in the morning and to go as long as it took. I had a team of, it was her and 5 other surgeons with her that were going to be working on me throughout the day. I knew it was going to be a pretty long surgery, and with my medical knowledge and my background, I knew that it was going to be very extensive. I also didn't really want to worry my family a lot, but especially my mom. She tends to be rather anxious to begin with. But I kept telling her, all I would tell her is, Mom, this is a really big surgery. It's big. And I'm not quite sure that she understood the extent. I think maybe she had an idea, but I didn't really want to tell her exactly how big. Also, going into it, I knew that my colon was quite involved. And reading the CAT scans and things that they had images of it, I knew that it was bad. So there were some things that weren't a real big surprise to me after my surgery that I had on the 29th of June. So the surgery ended up being about 12 hours long. And the medical team was, I'm told, very great with my family, my husband, my mom, my sisters. they came out at regular intervals, about an hour and a half or so apart, just giving them little updates as to what was happening and how things were going. I'm so grateful for that, because I know that that's a very long day with no communication. So I hope they appreciate that too. After the surgery, I apparently went to ICU, intubated. I don't really know exactly how long I was intubated and sedated. And I really don't remember a whole lot the first couple of days. Things are kind of fuzzy for those couple of days. I do remember like little flashes of points in time, but not everything. And apparently I didn't remember talking to one of my doctors, because when I did come to and realize that I no longer had a gallbladder and a spleen, which was something I didn't know at that point, I got quite upset and confronted my husband about it. Why didn't you tell me this? And he said, but you knew. They told you, and I was standing right here when they did. So that's how fuzzy things are those first few days after surgery. So I ended up having a total abdominal hysterectomy. They removed my gallbladder, my spleen, my omentum, which not many people know you even have one, but mine's gone. They did a diaphragm stripping, and my husband's here as well. What else did they do?
They removed your colon.
Oh, yes. It's one of the most important parts. They removed my entire colon. So now I have a permanent ileostomy. So that has had its own challenges, separate from having cancer. That's its own story in and of itself. I think that's it, right? That's all that came out.
Yes.
But I'm told it was about 10 pounds of tumor that they took out, which is pretty big. So now is the time to start to recover from that surgery, and my gynecology oncologist said that during the surgery it was evident that the 3 rounds of chemo I had did nothing to help get rid of the cancer at all. So that was aborted. That's all I had was the 3 rounds of chemo. The good part was they knew that my cancer was fueled by estrogen and fed by estrogen. So I now take an oral medication every day to suppress any estrogen that I may have. And that in turn, if you starve the cancer cells of what it feeds on, then you will kill them off. So as of now, I have been in remission since I got the official word September 19th of 2023. I do remember going to one of my follow-up appointments to my gynecology oncologist with my husband. We had a CAT scan that day, and then we were to meet with her later to find out the results. The conversation at the previous appointment had been, okay, we'll get this CAT scan, we'll see where we stand, and then I think we'll probably send you on to Dana-Farber. There's treatments down there that they cannot do where I was going, and they were thinking that that might be the route that I needed to go. But we get into the appointment with my gynecology oncologist. It's at a facility that's a teaching facility, so there was a med student that came in first who went through the results of the CAT scan with me. After surgery, I knew that there were still a couple of spots around the blood supply to my stomach of cancer that she could not take out at the time. Otherwise, it would have meant an entirely different outcome for me. So when they read the results of the CAT scan and the med student did not mention those lesions at all, I asked about them and wondered, what about the lesions around the blood supply to my stomach? And the student replied, well, I don't know, it's not mentioned here. My gynecology oncologist will know. And that she would come and review that with me. Right as those words left that student's mouth, the doctor came in. She also read through the results with me. I asked again about the lesions around the blood supply to my stomach, and she said, well, they didn't mention it because they're not there. They don't show any evidence of disease. Congratulations, you're in remission. She hugged me. I don't know if she had a tear in her eye or not. I think she may have, but my husband and I definitely were crying, hanging on to each other, totally not expecting to hear those words on that day. We thought we were being referred to much further in intensive treatment. So that really took us aback. So I progressed. I finally went back to work in October of 2023, part-time. It felt really good to be back there and to kind of have a quote-unquote normal life again. I think most cancer survivors will understand what I mean, because nothing's normal after that. It's like a little buddy that hangs around with you constantly, 24/7. The cancer thing is in the back of your head. It's always there. It never goes away. But you just do your best to carry on and continue and try to be as good as you can be. I have been so fortunate in my recovery. That's probably why I can't really keep it together while I tell my story, because I feel so fortunate and blessed to have such a wonderful man to be married to and have such great community around me. They gathered around me and supported me and did so many things for me and my family that I'm proud to call them my community, my support people. It is kind of hard to talk about this, but I have decided to share with it people because it's important that they know that there is hope out there. When I first got my diagnosis, I did not have a whole lot of stories that showed me that, yeah, people do survive this and they do well and they carry on. So I'm hoping that other people in similar situations will hear my story and get a little bit of hope that, yes, they can do it too.
I am Holly's husband, Rusty, and her explanation of her cancer and the treatments and the surgeries that she just gave is her side of the story. As the spouse and soon to become the caregiver for somebody who was just diagnosed, it became very quickly evident that having a nurse as a wife who was always able to answer questions and was always able to tell me I wasn't being healthy enough or washing my hands enough, very quickly what a dark road she was headed down after she knew what her issues were and her diagnosis, and before really chatting with any medical staff, that she just was not thinking that there was going to be a 4th of July. With her mentality set in that respect, there was not a lot I could do to cheer her up, to change her attitude, or to really lift her spirits. But I did remember that her now retired practitioner, her doctor, for quite a number of years, had always taken an interest in her and chatted with me, certainly after he retired, about her, was always asking about our family. and how she was doing and how her work was. And I think I recognized pretty early on that maybe if she could chat with him, that he could discuss, because again, she hadn't seen any of her doctors yet, just to discuss with her what she had, and hopefully that he was not going to share her kind of negative response to what she realized she had. So I was able to get a message to him, and he set a time with me to phone the house. I wanted to make sure she would be there at that time. And when she told him what was going on and what was happening, he very nonchalantly said, "But Holly, my mother had that many years ago." And Holly inquired of him just how his mother had made out, and he said, "Well, she's still with us. She was in her 90s at the time." And for the first time in many days, the look that I was seeing on Holly's face had turned to something a little bit lighter and a little bit more hopeful. We heard through her discussion that the first surgery was a failure, but it wasn't a failure. It felt like it when they were seeking me out only 45 minutes after the surgery had started, and we expected it to be quite a few more hours. And sitting there and discussing with her surgeon that they were unable to complete any of the tasks that they wanted to do because her cancer had spread so much that they were simply not prepared for what they found. And that we were going to start with chemotherapy, and that would happen while she was in the hospital within a day or two after the surgery, and that she was expected to do 6 rounds. And the game plan shifted very quickly, but in a positive way. She delivered these messages to us, always indicating that it was a bump in the road and that we were just going to adjust our steering to match what we were seeing down the road. So her chemo started, and within days, a very quick recovery from that first surgery. Within days, we were back home and basically preparing for what they were presenting to us as a very large surgery. And when that day came and we were prepping, we had actually stayed a night or two beforehand in the town where the hospital is, so that we wouldn't have to travel, because we knew she was going to have an early morning surgery. And we had her there early in the morning, prepped and ready to go. And then the task of waiting with family, with our children, that began. The doctors were very communicative. It took 2 to 3 hours into the surgery time period, where we were desperately trying to keep ourselves busy. We were walking, we were playing games, all the while not knowing how things were going, just knowing there were more surgeons assembled than we thought could ever possibly all work together in the same room. And one of the first calls that I got was from the doctor who had to make the decision that her colon and much of her large intestine had to go, and it would not be a temporary ileostomy, but permanent. And I can remember telling him on the phone that I was sorry that that was this decision he had to make, but I understood. And remember him, when I replied to him and I said it was one of Holly's greatest fears going into the surgery, that an ileostomy would be permanent. He just replied to me, "Really?" Like that was the most important thing. And I was a little dumbfounded at the end of that, not realizing, maybe because she was protecting us from how intensive this was going to be, but remembering that that was just the greatest fear she was sharing with me. And he somewhat minimized it, but made me realize at that point maybe things were going to be okay. Through the following hours, other surgeons were contacting us, and letting us know how she was doing, always telling us that she was doing well. And when surgery was finally completed and we got to meet with her primary doctor, she shared with us again everything went well and asked us very enthusiastically if we wanted to see Holly, which she tried to prepare us for what things would appear like, what she would look like. She said, your wife and your mother to our boys, she's going to look very bloated because we've given her a tremendous amount of fluid. And you won't be able to see much of her because they had her in large wraps that, to me, entering the room in ICU, she looked like she was in a tent. And we could just barely see a little bit of her face and one of her hands. And that was close to 11 o'clock at night on a day that surgery had began around 8 o'clock. Driving back to the hotel room for me that night by myself was hard. I didn't sleep much that night, and very early the next morning was ready to go back in and sit in ICU with Holly, hoping that they were going to chat about the next and upcoming days and how things were going to progress. And it quickly became evident that while she was there and that morning and the few nurses that I had spoken with, they were basically maintaining and not ready to take the tube out of her that was breathing for her. She questioned us when they actually removed the tube, why was she intubated? Again, being a nurse and not having expected that. And they explained to us that they were unable to start, what was the?
A block.
They were unable to
Pain
start
control
the
block.
pain control block for her before this surgery, like they did with the first, and that they were going to keep her in somewhat of a coma, but that I should stay and talk with her and hold her hand and make sure that she knew I was there. And that really was how that next day went. Full day of wondering how strong she was and hoping that things, as the days went by and the hours went by, she was going to improve. Our kids were back at the hospital with us at that point and encouraging them to come visit her one at a time along with her mother and her sisters. And I can remember we were outside the room at some point when they were pulling the tube and she was no longer intubated, because I had explained jokingly with her doctor how anything touching the inside of Holly's mouth or her throat would make her gag. And I was noticing that there was a lot of that kind of activity going on as I looked at her face and looked at her throat, that even somewhat unconscious, she didn't care for it. And they kept us outside the room while they removed that tube, and she was very gently being woken up. But my oldest son and I were the first into the room afterwards, and just remember that she was reaching for me and with a very faint voice saying my name, Rusty. In the days following, as she began to improve, the extent of her surgery and the number of drains that she had, and the tending to by the staff at the hospital, it was nothing less than amazing. And when she was strong enough to be moved into a different room out of the ICU, we had the pleasure of having her moved into a room with another patient. So we got to spend our 4th of July together. And the 4th of July was important to us because it was the anniversary of our first date. And it was in a very cramped little room in the old part of the hospital where there really was only room for one person, but 3 of us enjoyed that 4th of July holiday together. The following days and weeks that she remained in the hospital, the goal was to get her ambulatory. She'd been in bed for quite a long time, trying to recover from an incredibly invasive surgery. And my motivation was eventually to see her get up and be able to walk around. But one of the things that we dealt with shortly after the 4th of July was an infection. And the unknowns of treating that infection until they figured out exactly what she had going on made for some very stressful evenings and nights before it was discovered she actually had sepsis. And she was taken many times for many trips down to imaging so they could place drains and so they could try to irrigate drains that were already in place. And until they had figured out exactly what it was, it just brought us that much closer to feeling like we'd never get her home. When they were able to finally treat her infections and rather enjoyably get to see them removing drains one by one, we got to the point where she was physically able to get up, get out of bed. Very minimal movements and walking, happiness in the milestones of being able to move from a bed to a chair and sit upright for 15 or 20 minutes. And then eventually getting to the point where physical therapy visits were patting me on the back for making her walk around the unit and having her try going up and down the little stairs that they had to do to prove that they could go home. When eventually we got good enough that after 3 to 3.5 weeks, we were able to return home. Wondering if we'd be successful, wondering how soon it would be before we'd be back.
Still with one drain.
Still with one drain to tend to at home, and a husband who had no idea what he was doing, but he had a nurse there to train him and make sure that he was going to be successful. And she did not let me fail. Queasy as I am at the thought of doing any of the things that I did to assist, she got me through it. And day by day, once we got home and realized she was going to need frequent infusions of fluids, she did gain strength day by day. And through the help of all these doctors and through the help of family and the community around us who really came together to make sure that we were taken care of, that we didn't have to think about or worry about things that were pretty small in comparison, it really made us appreciate how blessed we were with the community and the family surrounding us.
So after the June 29th surgery and my 3-week plus stay at the hospital, which originally was supposed to be about a week or so, but I had many bumps along the way, one of which was an infection, sepsis. Took a couple of days to figure out exactly what germ it was that was causing it and what antibiotics would treat it. But once they finally did getting the appropriate treatment, I did start to feel a little bit better. At that point, I had lost so much strength. It was amazing how quickly it left. They always teach us nurses that you lose so many percentage of muscle mass while you lay in bed, and you really don't understand it until it happens to you. So I had my husband there with me almost every day. He only went home once, I think, during the 3-week stay, just to take care of things that he had to do. But he's my rock. And he prodded me and poked me and made sure that I got up and started walking. And I was doing the best that I could, which, to give you an idea, when we got home, our bedroom is upstairs, second floor. We have 14 stairs to get up to the second floor. And I was determined that I was going to sleep in my own bed for the first time in what seemed like forever. And I was going to walk up those stairs, which normally you don't even think about. You go up and down stairs and you just do it. It doesn't take long at all. I think it probably took me more than 5 minutes to get up those 14 stairs to get up into my bedroom, but by golly, I did it. And it got a little easier as time went on, till one day I remember coming down the stairs and reporting to my husband that I hadn't even thought about it. I didn't even need to stop in between and rest, that I made it from the top to the bottom without resting, and I didn't realize it until I got to the bottom. I actually yelled out to him or messaged him or called him or something and said, guess what I just did? And I didn't even realize it. It was the little moments, the little wins that really move you along, and that was one of them. But even though I was on the road to recovery, it doesn't end there. There's still more. There's many, many doctor's appointments. And one of the big bumps that I have is the ileostomy. And for those of you that don't understand what the function of your colon is, the colon, after it has gone through your stomach and your small intestine, the colon's job really is to absorb moisture, the water. And so I no longer have that colon, and it's not absorbing water. So therefore, I was getting dehydrated quite easily because things would just move very quickly through my system. So along with the fact that my body had gone through such an assault and such a trauma with such the large surgery, nothing really tasted good to me. It was a struggle for me to drink water and not have me be nauseous from it. I have to say the one thing that got me through that summer is kind of crazy, but they're like slush puppies. They're called Frazzles now. There was, at our local convenience store, thank goodness they had these slushies, and I would have my family go down and get me one every day, the largest one that they had, and that's really the only thing that tasted good and that I could keep down. They kept me alive that summer, along with all the doctors. I spent most of the half of July and all of August pretty much, almost every weekday at the hospital, my local hospital, getting IV fluids and replacements for potassium and magnesium, those kinds of things that keep your body going, because I wasn't able to maintain and intake as much as I needed to. So I got lots of IV fluids, and my husband and I spent lots of time on the road going back to the larger hospital for follow-ups for many, many surgeons, all the different specialties, the GI doctor, a urologist, the gynecology oncologist. We saw them all. Made lots of miles on our vehicle, for sure. So there were lots of bumps in the road, and eventually things got better, a little better every day, until we did lead up to that day, September 19th, when we thought it was, okay, what's the next step? But we had the very glad news of you're in remission. And here I am, 2026, still in remission. So just keep that in mind. I think one of my mantras that I followed was, I'm going to do this, I'm going to continue to fight, and I'm going to do it with grit, grace, and gratitude. And that's kind of been my mantra. And just know that there is hope. Don't give up. Keep fighting. And the other thing that I kept envisioning was myself on the other end of this cancer journey. I keep picturing what things would be like on the other side, that things will get better. And they do. So that's my story.